Lindia Willies-Jacobo. I'm professor of pediatrics at UC San Diego School of Medicine. I also serve as the assistant dean for diversity and community partnerships, and I'm the director of Prime Health Equity. When one looks at the literature, it's clear when you survey patients, for example, they will tell you that they are most comfortable when they're engaging with a doctor who seems to understand their background. We further know that patient outcomes are largely dependent on how satisfied a patient is with the entirety of their experience. And when we think about what we're doing with patients, it is important to ensure that we're not simply engaging with them in clinical settings, but we have to be able to think beyond. And if our goal really is to ensure the best outcomes for patients, then it does matter that physicians have that deeper understanding of the cultural backgrounds that our patients come from. My main role, certainly at the School of Medicine, is looking at ways to recruit and retain students traditionally underrepresented in medicine. I think when we look at the face of medicine, it's clear that representation is not there. We're not necessarily at a place where we are meeting the needs of the very diverse healthcare or the diverse population that we serve in San Diego, especially as a border town. We serve a very large Latino population at Rady Children's Hospital, which is where I spend a good amount of my time working. About a third of the patients that we see are from those surrounding Latino communities. And when we look at the physicians who are providing care, although I think most are in fact providing culturally and linguistically appropriate care, the face of the physicians, if you will, and just sort of the entirety of the physician workforce doesn't seem to entirely match the population that we're taking care of. And so we're constantly reminded of the challenges that we face, even in pediatrics, to ensure that we're recruiting students to become physicians for those very diverse communities.